I'd like to invite all of our guests out here to the Infosys office in World Trade Center in downtown Manhattan. We are delighted and humbled to be partnering with the Estee Lauder group of companies and the Breast Cancer Research Foundation in this initiative to help raise the awareness on breast cancer. Today we are celebrating the Tech Day of Pink, an idea, a concept which has been evangelized by my friend Michael Smith, who would soon be joining on stage. Breast cancer is a challenge that we all live with. It's a challenge for humanity. Half the battle in combating breast cancer is awareness. The remaining half is early detection and targeted therapy. Today we'll be joined by a very esteemed panel of guests from the fields of healthcare, from the fields of prestige beauty, and a very esteemed media anchor who would be facilitating a discussion on how do we come together as different parts of industry in helping raise the awareness on breast cancer. But before we do that, I'd like to call on stage my friend Michael Smith. Michael.
Thank you, Karmesh. Good afternoon, everyone. All right. Thank you all for being here, and as well for those of you that are watching online. Very much appreciate it. I also want to thank Infosys and Karmesh particularly for just putting this together for this amazing panel that I think is going to be so interesting, and the tremendous support for this cause, and also for just being a great partner for the Estee Lauder companies. Thank you. And, you know, It is an honor to be here to recognize Breast Cancer Awareness Month, and particularly the Tech Day of Pink. You know, breast cancer prevention, detection, that's a cause that is close to many of our hearts, and mine personally. I believe you know this stat, but every 15 seconds, a woman somewhere in this world is diagnosed with breast cancer. And there's been significant progress over the last few years in the fight to really end this terrible disease. But the fact of the matter is, there's work still to be done so that we can change that statistic. And at the Estee Lauder companies, I can tell you, we are committed. We're committed to uniting and inspiring people everywhere around the world to create a breast cancer-free world. You know, Estee Lauder companies, I'm proud to be a part of it, and we have been a leader in the breast cancer movement since Evelyn Lauder created the iconic pink ribbon, and she founded at the same time the breast cancer campaign. And since that time, in 1992, the breast cancer campaign has gone on to make really meaningful impacts, actions, really in the fight to end this terrible disease. And it's also become, for us, the Estee Lauder companies, it has become our largest corporate philanthropic initiative that we have. You know, it is thanks to partners like Infosys, other partners around the world, our consumers, our employees. We've been able to make a significant impact, raise over $79 million to fund global research. Medical services, and education. And it really was, when I joined the company in September of 2017, it was that program and just my own personal experiences. It was that program that inspired me. Just the reach and the impact that it had inspired me to say, what can we do as a technology function to make a difference and to be a part of this? And, you know, it started with that first year, just an internal effort. We just looked to the IT team and we said, we're pink on this second Thursday of October. Post on social media with the hashtag. I will donate per post. We'll hold pink parties in our offices around the world where we can do raffles and raise money. And you know, to my surprise, the response was incredible. And the word had even leaked out. And I, you know, on that day when scrolling through social media, saw a number of our partners and other colleagues that I'd worked with in the past had actually posted as well. And that's when it hit us. There's an opportunity to make this bigger. And last year, quite frankly, with a tremendous leadership from Infosys, we were able to have a huge impact worldwide last year in raising awareness and taking this to a new level. And this year it's even bigger. And you know, I was asked before I got up here, what do you want to get out of this panel? And I said, this panel is really the start of Tech Day of Pink 2.0. If we look at the first couple of years, and even this year, it was really about awareness. It's making people aware that this is something, this terrible disease that people struggle with, and we're so close to being able to put an end to it. And we have so much power to save lives, to just create that awareness. But then this year it went deeper. We have partners doing things like this panel for education, and we've had partners in other companies step up and they're doing they've been inspired to launch women's health campaigns, year-long women's health campaigns, and do pop-up health clinics and offer free mammograms. That's the next step. But now this panel, what I hope to get out of this is that this is the start of really what it means to rally the technology community in the fight against breast cancer, is how do we apply technology in new ways? How do we think, somebody earlier said, it's like a big global hackathon against breast cancer. How do we strike that open source way? And that's what I hope to get out of today and to launch today, to set those sparks. And so, again, I just want to say thank you to Infosys for making this effort to pull this together and bring this great panel, esteemed panel together. So thank you so much for that. And the day's not over, so I encourage you to continue to take pictures, to post using the hashtags TechInPink 2019 and Time to End Breast Cancer. Every post raises awareness, but it also raises funds and donations. So thank you all.
Thank you, Michael, for that inspirational opening. I would now like to call upon stage Seema Mody, renowned media host from CNBC. Seema, please. We also have three guests with us. Dr. Aymen Elfiky, Division Director, Hematology, Oncology at the Brooklyn Hospital Center. Dr. Peter Stetson, Chief Health Informatics Officer at the Memorial Sloan Kettering Cancer Center. And Lynda Pak, Vice President, North America Technology at Estee Lauder Companies.
All right, thank you, Karmesh, and good afternoon, everyone. I'm excited to be here to have this discussion around the role that Infosys, Estee Lauder are playing in trying to further advance awareness and also research around breast cancer and this fight to make this world a breast cancer-free world. Thank you all for joining us today. And Lynda, I'd love to kick off this discussion with you and just to get everyone in the room up to speed with some of these astounding stats, and Michael alluded to some of them. The Estee Lauder company's breast cancer campaign is the company's largest corporate philanthropic initiative. It's raised more than $79 million, more than $65 million funding towards 260 medical research grants through the Breast Cancer Research Foundation. So the company is certainly trying to play a pivotal role in this fight. And the company's participation, you could say, is an authentic way to connect with colleagues around the world and really link it back to the company's values. So Lynda, what does this campaign, this initiative really mean to you personally and being a part of such a grand initiative?
Thank you, Seema. Well, it is just absolutely incredible to be part of an organization that has such a big heart on around this cause, and it's just part of our family values. It is in our DNA. It's something that you almost don't think about because it is so important for us as a company that. Of course, we're going to look to celebrate October or to participate in such a philanthropic way. So it's days like today, and it's months like October where it is Breast Cancer Awareness Month, where I'm not only reminded of the fact that I am working for an incredible company, a leader in prestige beauty, but we're also part of something even bigger, right? We're part of something worldwide. We're part of potentially touching every woman on the awareness, education, and cure fund, from a cure perspective for something like this. And I can't tell you how proud I am to make even a small impact. I mean, just some of the things that we're doing. Michael talked about Tech Day of Pink and what we're doing ourselves, not just being part of this panel today, but back in our offices all around the world, we have fundraising opportunities where we have big sales happening, we have raffles happening, we have, again, we're posting on social media because using the hashtags is going to allow us to raise enough funds for another year of breast cancer research. So how amazing is that? So it is such an honor to talk to you today about the amazing things that we do across the globe.
And Lynda, you've played certainly an extensive role in furthering this effort. What is your advice, not only to people in the room, but even individuals who don't work at Estee Lauder and even corporations, to identify those low-hanging fruit and figure out how they can play a personal role in this journey towards a breast cancer-free world?
Well, we talked about awareness and we talked about detection / prevention, right? So if you think about awareness, if I reached out to 10 women in my life and I could tell them about breast cancer, what it is, how to check themselves, go get a mammogram. For all the ladies out there, it is not pleasant. But it's not just something that you do at a particular age, because now I'm 40, because breast cancer also hits earlier ages. My cousin had a double mastectomy at age 32 before she was recommended a mammogram by her gynecologist. And so this is an opportunity to tell that story that is going to be relevant for every woman out there, and they're going to tell their friends, and they're going to tell their friends, and they're going to tell their friends. So that's one of the simplest things to do, is to get yourself educated and to be able to share that with some of your closest friends and family members. On the research side, we talked about helping fund breast cancer research. And that is very easy to do. So we talked about hashtags. You can draw a pink ribbon on your hand, take a photograph, and use one of our hashtags. And that is going to help donate funds. You can volunteer. There are breast cancer walks all over the country every year. And I've done that for many, many years. I've formed my own teams. We've raised funds for the breast cancer walks as well. And that's another easy way to do things like that. One of the, and it's not just getting involved with these types of activities, but it's also volunteering, right? Volunteering to, with these organizations where you're going to give back your time so that they don't have to pay an administrator to do certain tasks. You volunteer your time to do those tasks. And that is, every penny is valuable for these organizations who work so hard to one day come up with that cure. And those are the low-hanging fruits. Michael talked about, can you imagine getting the brain trust in a room or around the world, getting other technology companies like the Googles, the Facebooks, the et cetera, and getting them to all do this together and coming up with some incredible ways around awareness, detection, and the movement to help fund this cause. I mean, those are things that we can do with our own networking contacts that we have ourselves. And my husband happens to work for Facebook, and I'm constantly, honing in on, you gotta, wear something pink today. You've got to post something. You've got to get the word out to every woman that you know on your team and get them to get the word out as well.
No, that's a great point. That pink, that pink color around this month, that certainly goes viral every year, it seems, on social media, as you point out, which, as you point out, is a movement in itself. Let's dive into the science, Dr. Aymen Elfiky. May I call you Aymen?
Please.
Okay. So there are researchers that predict that in the next decade, we won't need a specialized oncologist because primary care doctors will have access to cutting-edge AI technology. And as an oncologist, I want to understand what your thoughts are on this prediction, this potential prediction, and the use of data sciences in furthering this journey, and what you make of this prediction in general. Is it largely an exaggeration?
Not an exaggeration. I mean, I think we're at a point now, and we have to be willing to, and I think technology, where we are today, encourages us to think beyond boundaries and to know that we can work beyond wherever limits that we didn't think we could work beyond in the past. But now with the way technology, social media, different aspects of technology has motivated, just has changing society, how it's motivated the people at large, the patients, and then certainly the doctors, the mindset is evolving. There is going to be more of, and the hope would be that there's going to be more a move, more earlier on in terms of prevention, echoing the importance of awareness. And then the primary care physician really as that sentinel caregiver in a person or a patient's life can and will be able to play more important roles in terms of identifying, especially cancer, as we're starting to learn more about it, the genetic hereditary underpinnings of it, environmental effects, who is going to be the caregiver who is positioned best to affect health at an earlier and preventative stage. It is going to be that primary care physician, but also want to highlight even the people themselves, and the patients will also be enabled by AI and technology as these become part of our daily lives.
What are your thoughts on the role of crowdsourcing, which I know is something that you've been paying attention to in driving better diagnostics and also amplifying the effectiveness of a physician?
The wisdom of the crowd. So we know, especially all of us, by virtue of experience, sometimes bias can creep into our daily lives. So then there is that benefit, just as you see in daily tumor boards, for example. We are using the wisdom of the crowd, the different experts, everybody building upon or bringing their own experience, their own patient populations and what they've learned from them to bear on a particular case at hand. Same thing, it's a corollary that applies there. And again, crowdsourcing from patients' perspective and what patients have to learn from each other, and even just people at large before they are actually patients or have an actual illness at hand. What can we learn in terms of, again, prevention and just being aware of what kind of risks are we at, if any.
And what does that ultimately mean for breast cancer patients?
Breast cancer, we appreciate, for example, I mean, there are pockets, so there are different risk stratifications that certain people fall into, certainly because of hereditary genetic aspects of that. Same thing, understanding your family history and what implications that can have for your own risk or other people's in your family. Again, so to be able to learn from our own histories, our own communities even, right? There are certain pockets within the community where it's certain risks for reasons. The more that is understood, shared, then the more then that really impacts our daily lives and our interaction. Of course, there's an important part that the healthcare system has to be more inviting and open. That's why there's important, like to encourage people and patients to advocate for themselves, but that knowledge is really enabling.
And Dr. Peter Stetson, we'll talk about the intersection now of data and data science as a pathway to improving cancer care, and also the training that comes with that, understanding as a physician how to leverage that data to the fullest extent. Can you elaborate on that?
Sure, and I could even pick up on the other panelist's point about enabling patient-generated data to be actually incorporated into the process of care for our providers, and understanding how to leverage that data and build predictive models that help us get patients to the right test at the right time, including basing that on their personal risk and tailoring their treatment plan to their personal risk. is something that we think a lot about, and takes a lot of data science to understand what the best model is that can support that, how to get that into the hands of the clinicians who need to take action on that, or get the patient to the right genetic screening testing before, just to understand their baseline risk. And what we see in the work that we do at Memorial Sloan Kettering is that increasingly the way we take care of patients, we seek to understand the biology of the tumor in the patient and the patient themselves, and better tailor the therapy that we give to those patients based on that. And that's a new world for the way we deliver care. And a lot of older clinicians and nurses haven't been trained on the new computational models, understanding what a predictive model actually means. And so there's a real opportunity to work with patients, with families, caregivers, scientists, to bring together those different teams to understand how to train the next generation of our clinical team. The way we do that at Memorial Sloan Kettering is putting our computational oncologists and our bioinformatics folks together, literally in the same room, with our clinical experts in breast cancer to understand how we could better take care of our patients, including taking into account what the patients actually tell us about their family history and their symptoms, and baking that into these predictive models. So that's just very new science and very new care delivery methodology that I think we are moving towards, and having a tech community who can help us get after that data, understand it, build these models, and turn it into actionable information for our clinicians and for their patients is the new era of medicine.
I guess that would create a challenge and an opportunity for physicians, right? In ensuring that you're up to speed on the latest and greatest technology, but also ensuring your staff is being trained on a regular basis. As an industry evolves and learns more, your staff needs to also understand how to use that technology. Yeah.
Absolutely. Using the technology and using the information that comes from that technology. Some of that technology is precision diagnostics, so new imaging, new pathology, digital imaging, and how to make sense of that. Some of that is in your workflow. If you're seeing a bunch of patients in a given day, it's got to be quick. It has to help the provider get through their day,
Sure.
and it has to help the patient know what they need to do when they go home.
And what would you say, Peter, the hospital experience, the power of analytics in helping improve not only hospital services, but the decision-making that's happening on a daily basis?
At the organizational level,
Yeah.
or in the clinics?
I guess both.
I think at the point of care, understanding how to bring information into the hands of the clinicians in their workflow is one of the central challenges. We found these are complex new data types, and getting those in front in understandable ways in front of our clinicians is something challenging, and it's what we concern ourselves with in informatics, and how we can help good decision support. And then at a population level, or at for an outreach program or a cancer control program type level programmatic effort, understanding how our patients are moving through that journey, and where they are, where their needs are, what extra resources they would actually need to also do well in survivorship. We've talked a little bit about early detection and prevention, but another key aspect of this is getting the right treatment, and getting all the way through the treatment, and having that treatment be directed specifically at that particular tumor in that particular patient to optimize the outcomes for that patient, and hopefully then manage them successfully all the way through their survivorship journey.
Wow. Yes, please.
So from a population health perspective, because there are, for example, where I'm at in Brooklyn, we have more marginalized populations, and so there's opportunity on the organizational level to be able to apply population informatics, population health, to be able to tailor resources to direct outreach efforts. And then if you look at it from operationally within a cancer clinic itself, or the division, to be able to optimize your value chain, whether from supply chain, how do you organize your infusion days, Again, so the data and integrating it with your operations really plays an important role from start to finish. And we're just at the tip of the iceberg in terms of appreciating the impact it's going to have.
Yeah, it certainly seems so. And you just, how you all discussed the intersection of data, science, and medicine. There seems to be a real interest here in furthering not only ways to create early prevention and early prevention, but also finding ways to really further advance the research around this space.
That's right.
Well, this was an informative discussion. I certainly learned a lot. Thank you so much for providing your viewpoints, Aymen, Lynda, and Peter. Appreciate it. Karmesh, I'll send it back to you.
Thank you, Seema, and thank you, Aymen, Peter, and Lynda. It was a very insightful discussion, and I do hope all of us from different walks of life, from different professions, coming together, raising awareness around breast cancer, and really using this Tech Day in Pink as a phenomena to help further the advancement in treatment, in detection. And we do hope that we will be, through this journey, bring more participation of colleagues, of technologists, of healthcare practitioners to come and join hands in the fight against breast cancer. Thank you.